There is a 5 phases of action potential. Resting membrane potential is different for the different tissue. Minus 90 milliwatt in myocytes of the heart and the skeletal muscle. Minus 70 milliwatt in nodal cells like SN node and AV node and in neuron.
So
Minus
there is a
40
phase
to
0,
minus
which leads
60
to
milliwatt
sodium
in smooth
influx,
muscle.
activation of voltage gated sodium channels leads to the deporization. Phase 1, potassium out, efflux, early repolarization. Phase 2, activation of L-type calcium channel, play 2 phase. Phase 3, potassium out, efflux, late repolarization. If continue, that will lead to phase 4,
Continue potassium out leads to
hyperpolarization, minus
hyperpolarization.
90 milliwatt from minus 70 milliwatt, more negative inside. And there is a talk about the heart, no phase 1 and phase 2 in SA and AV node, while all phase present in atrial, ventricular, myocyte, Purkinje fibers. Phase 0 is due to L-type voltage gated calcium channel in SA and AV node, while in other cardiac conduction system, myocytes and Purkinje cells, phase 0 deporization is due to opening of voltage gated sodium channel. In heart, phase 4 is very important because it leads to activation of hyperpolarization activated cyclic nucleotide gated channel known as a funny channel funny current, which leads to the slowly influx of the sodium and potassium and bring the membrane potential inside minus 90 to minus 70 millivolt resting membrane potential RMP. After reaching RMP state, minus 70 L-type voltage gated calcium channel activated, and what is the deporization? This potential is known as a pacemaker potential. Hyperpolarization leads to also activation of inward rectifier potassium channel. Inward rectifier potassium channel, which leads to influx of the potassium and bring back the membrane potential to RMP state from minus 90 millivolt hyperpolarized to minus 70 millivolt. It is not that the potassium inward rectifier can do the efflux and influx as well, but inward movement preferred more by the channel, that's why it's known as an inward rectification. There is no such channel for sodium inward rectification. Potassium inward rectification, there is various type channels. One present in renal tubular cells, channel 2 present in heart, channel 3 present in heart, SA and AV node, 2 present in other system myocytes, and 3 also present in neurons. Mutation in KIR3 leads to the in neuron epilepsy seizure. Mutation in KIR6, which present in pancreatic beta cell, leads to neonatal diabetes. It is ATP sensitive and ATP dependent. KIR1 mutation also leads to the Liddle syndrome in renal. So both, in summary, the smooth muscle and cardiac muscle except SA and AV node have the plateau phase. Smooth muscle and cardiac muscle have the plateau phase except SA and AV node in heart, while in skeletal and the neuron there is a no plateau phase. Only depolarization, full repolarization. No phase 1 and phase 2 in SA and AV node. Yes, there is a no early repolarization and plateau phase in SA and AV node. There is a no early repolarization phase 1 in skeletal muscle. and phase 1 is mild and less prominent in smooth muscle and neurons. In smooth muscle and SA and AV node, phase 0 is by L-type calcium channel, while the skeletal muscles, other myocytes, neuron, phase 0 is by voltage-gated sodium channels. Skeletal muscles, nuclei lies periphery, smooth, and the cardiac muscle cell nucleus is lie centrally like other cells. Exception is the skeletal muscle nuclei lies periphery towards the cell membrane, muscle cell membrane, also known as a sarcolemma, sarcolemmal membrane. Sarcolemma invagination leads to the inside formation of the T tubules. No such T tubules in smooth muscle. Instead, it have the caveola. Invagination of sarcolemma known as the T tubules.